This is pretty alarming. Tell us more about what you're learning.
Marcia, alarming numbers, notably focusing on those years of the COVID-19 pandemic, which were, of course, a huge upheaval for so many of us. Now, obesity rates have been on the rise significantly over the past several decades. The number of obese adults in Canada has increased substantially over the last 30 years. Now, this new study, just published, as you mentioned, in the Canadian Medical Association Journal, looked to focus on the impact on our health and trends in obesity rates through the COVID-19 pandemic, and it found an increase in obesity rates, and that is defined by body mass index. Now, over the 15 years of the study, it rose more than 8% from just shy of 25% of Canadians in 2009, nearly a quarter, to nearly 33% in 2023. And notably, that sharp increase, the rate nearly doubling during the COVID-19 pandemic timeframe. And that is of significant concern, of course, not just for our own physical health and well-being, but also the cost of the healthcare system in Canada. It's pegged at the close to $10 billion in 2021. And so focusing on these numbers during the COVID-19 pandemic is where the research really put its time and effort in to see this spike throughout that time frame, Marcia.
Yeah, and it looks like women and young adults especially impacted by this. Scott, what needs to change then?
Yeah, that's incredibly concerning, particularly for young adults, because, of course, there's so much of their adulthood still ahead of them, where these other risk factors that can come into play with obesity could then affect them for much longer. So the research mostly focused on the numbers here to see the trends during the COVID-19 pandemic compared to before, and didn't dive into specific reasons why the sharp increase. But the COVID-19 pandemic, of course, we all know, was a huge upheaval: isolation and lockdowns, public health restrictions, closures of gyms. Many people lost their jobs. So the physical and emotional toll we put on our bodies, though, was incredibly severe, with, of course, adverse changes to physical activity, stress, and mental health, all likely playing a factor. So, as I mentioned, the study didn't investigate specific solutions at this point. But when it comes to treating obesity, medical health professionals point to ensuring policies are created to treat and manage obesity, as well as the other risk factors that come along with it that are associated, including type 2 diabetes and heart disease, particularly if we're seeing more obese young adults. And so that includes, of course, more research, more funding, and ongoing public health campaigns to ensure people are focusing on their physical health, their mental health, that it's all tied together, and that there are the resources that are needed for people that do need it when it comes to these rising obesity rates, Marcia.
Scott Hurst for us. Scott, thank you for that.